Good evening, everyone. My name is Clarice Redding Lewis, Chief Recovery Community Officer at Hanley Foundation, and welcome to the second installment of our Recovery Leadership Institute's Summer Recovery Leadership Training Series. At Hanley, our mission is to eliminate addiction through prevention, advocacy, and recovery support. You can learn more at hanleyfoundation.org. I'd like to take this time to thank our community partners, Palm Beach County Community Services Department, as well as the Palm Beach County Hub. Just as a reminder, tonight after our presentation, we will have a moderated Q&A. So those of you watching at home, please feel free to drop your questions in the chat. I want to begin tonight by introducing the title of our series, The Role of Family in Recovery. We have our three esteemed panelists joining us this evening, and I'll go ahead and introduce you to them now. First, we have Robin Tupper. Robin is originally from Vermont and moved to Florida 37 years ago with her husband. Here they raised two sons, and as a born caregiver, retired nephrology nurse, and a mother of loss, Robin has taken her compassion, belief, and fight for the underdog to advocating for the homeless and uninsured battling substance use disorder and mental health disorders. She became part of the leadership team for the Palm Beach County Hub in 2019, helping to open the doors of a recovery community center that meets individuals where they are. To balance these efforts, Robin loves to garden, spend time with family, and play with her two labs. Thank you for joining us this evening, Robin. Next, we have Cindy Singer. Cindy is a retired middle school principal from Long Island, New York, where she raised three children. Tragically, Cindy lost her beloved son, Rory, to an accidental overdose in 2015. She is driven by her calling to help others and has made it her personal mission. Together with her friend Staci, they founded the nonprofit Our Two Sons in 2017. This was created to assist with substance use disorder in all phases of recovery. These moms on a mission were recently featured in the December 21st edition of People magazine for the work that they do here in Palm Beach County. Cindy is thrilled to be an active board member of the Palm Beach County Hub, and her best times are spent with her daughters and granddaughters. She enjoys traveling the world, hosting parties for family and friends, and learning about different cultures. These are just a few of Cindy's passions. Next, we have Staci Katz. Staci is a native of Brooklyn, New York, and has served as a New York City police officer. The theater, beach, and traveling are just a few of Staci's passions. Her son, Dylan, is an accomplished tattoo artist in Palm Beach County and is currently in recovery. Staci is also on the board of directors for the Palm Beach County Hub and is passionate about her personal mission to help others, which we will learn more about this evening. Please join me in welcoming our guests tonight. And as always, if you have any questions or concerns, consult the chat box. Thank you, ladies, for joining us.
Thank you. Thank you. So we'd like to welcome you tonight. It's our pleasure and our thrill to be sitting here at the Palm Beach County Hub, which is a labor of love for all of us here and many of you in the audience. I'd like to give you an overview of what we will be speaking about this evening. Of course, we will be talking about substance use disorder and how it affects the person and the family. We'll be looking at principles of care. We'll be looking at how we can change the conversation to reduce the stigma, the language, because language matters. We'll be looking at the new dynamic in family relationships. We'll also be looking at treatment questions and components, family and grief support groups, how there are multiple pathways to recovery, and some of the other issues that surround recovery, such as harm reduction. What is it? How we can have coping skills and mindfulness. And finally, we'll look at resources and a call to action.
Substance use disorder, a brain disease. The American Medical Association definition of addiction: addiction is a complex condition, a brain disease, that is manifested by compulsive substance use despite harmful consequence. People with addiction, severe substance use disorder, have an intense focus on using certain substance or substances, such as alcohol or drugs, to the point that it takes over their life. Science has proven that substance use disorder is a chronic brain disease that can be managed with medical treatment. It is not a moral failing or a character flaw. But still, only 1 in 10 Americans with a substance use disorder receive treatment today. Addiction is highly stigmatized, and that stigma is fueling an American public health crisis. About 45% of us think that all that's required to overcome addiction is willpower. Less than 20% of Americans are willing to associate closely with someone who is addicted to prescription drugs as a friend, colleague, or neighbor. 33% think addiction is caused by a character defect or bad parenting. The national drug overdose deaths number among all ages by gender through 1999 to 2018, you can see on this slide that the numbers have continued to increase. In 2018, the number was 67,367. In 2019, it went up to 72,000. And last year, with the occurrence of COVID, in addition, the numbers went up to 93,000. These are staggering numbers, and we still have a long way to go to make changes. Shatterproof has created national principles of care, standardized quality expectations. These are things that we would like to see happening for our loved ones when they're receiving care, ongoing management of their disease processes, and just support in life. Most of the time, these things aren't happening. One would be routine screenings in every medical setting. 2, a personal plan for every patient. It's an individualized disease. Fast access to treatment. Long-term disease management. Coordinated care for every illness. Behavioral health care from legitimate providers. Medication for addiction treatment. And recovery support services beyond medical care.
Welcome, everybody. Thank you for having me here. I'd like to discuss how stigma impacts recovery, as we all know that it does, and this needs to change. Stigma can reduce the willingness to seek professional help, cause reluctance to attend treatment, limit access to healthcare, housing, and employment, diminish self-esteem, exacerbate depression, and affect personal relationships at a time when they are needed the most. What is stigma? Stigma generates multiple barriers for people with an opioid use disorder to seek treatment, receive treatment, and stay in recovery. Its totality means people with OUD, which is opioid use disorder, can progress on their path to recovery and still be faced with a gauntlet of discrimination and continued barriers to recovery. We see that on the slide. It says public stigma, which involves the society's negative attitudes towards a group of people, creating an environment where individuals feel unwelcomed, judged, and/or blamed. An example of this, less than 20% of Americans are willing to associate with a friend, colleague, neighbor, or someone with an opioid addiction. The next we see is structural stigma. Systems-level discrimination caused by institutional policies and/or dominant cultural norms. And examples of this, 25% of emergency medical or family / internal medicine professionals feel that treating opioid use disorder will attract undesirable patients to their practice. And just to add to this, families are also treated this way. Self-stigma, where individuals accept societal stereotypes and experience reduced self-esteem and self-efficacy. An example, John, a young adult with an opioid use disorder, enters evidence-based treatment. However, he has internalized negative messaging from society, making him feel unworthy of recovery and isolating him from his friends and family. We have had people come to us and tell us that they're not even good enough to be in recovery. They're not even good enough to be in halfway houses. Things like, where are the parents? And that this must be a moral failing are questions that add to the stigma. Language matters. There are a lot of things that we're trying to get people to understand about the way we should use the language and how we can better use language to not bring such a negative connotation to this, and furthermore, understand it as a disease. The first one is addict. And where it says in there, it says stigmatized language, which would be addict. And the preferred language we'd like is to use is person with a substance use disorder. The second one says addicted to X, which could mean addicted to anything. Person with a substance use disorder. Addiction. Instead of using the word addiction, we'd like people to try and use the words substance use disorder. Sometimes people use the acronym SUD. Alcoholic. Person with an alcohol use disorder. Clean. We prefer people start using the word abstinent. Clean screen, which means that someone is substance free. Dirty means actively using. And those clean screen and dirty screens, I believe, were attributed to the urinalyses that were given to people while they were in treatment and in recovery. Drug habit, person who uses drugs. Reformed addict or alcoholic, a person in recovery. Opioid replacement, medication-assisted treatment. Recreation or casual user, person who uses drugs for non-medical reasons. And the last one, experimental user, a person who is new to drug use, sorry. An example that I could give is I have an 86-year-old mom who is in an assisted living facility, and she sits around the dinner table one day and someone starts talking about an addict, and from the lessons that she has learned in her own family, she speaks to them and says, I would appreciate if you don't use the word addict. And we are never too old to learn. And that's why this language matters and is so important. Thank you.
Next, we're going to talk about new dynamic in family relationships. So now what is the question? We have a loved one who is seeking treatment. And I wish I would have known some of these questions to ask, but it's not too late for me to put purpose to my pain and pay it forward and help someone. So when they're going to look for help for their loved ones, they might want to ask some of these 10 key questions for a potential rehab center. Number 1, what type of treatment method does your rehab program use? Number 2, are your rehab programs personalized to each client's needs? Do they meet the client where they are when they come in? Is your rehab center licensed and accredited? What type of detox does your detox center offer? And I just want to say that many times the rehab center doesn't offer detox, and detox is done at another place, and then people go to rehab. And how long are your rehab programs? Typically, some are 30 days, some maybe 60, 90, or even more long-term rehab. People seek long-term recovery. How much do your programs cost, and what are my payment options? And another question that I needed to ask is, do you take my insurance? And I want to know now before I send my loved one there, because I don't want my loved one to get there after you tell me yes, and then they're asked to leave. So that's a real red flag for me that I wanted to share with all of you. Are you able to treat clients with a dual diagnosis? Often people have substance use disorder and some other type of diagnosis, usually some sort of mental illness. And many places don't know how to treat both, but many do. So it's important to ask that question. What type of continuing care services are available after rehab? Is there a community center nearby? Very important. One of the issues that I faced was that after rehab, there was nothing. There was no continuum of services. There was no place to go afterward. Often people get out of rehab with the shirts on their back and little else. And that's where a community center or a peer support would come in to help. Does your treatment program provide treatment support? And that's just what I was talking about. What happens afterwards? And what makes your treatment, your drug treatment, different? Many places offer different services, and it's important to know what comprehensive services they do offer. Two others that I thought of was that, is there a licensed medical professional, such as a doctor, on staff? It helps when there is. And what is your protocol for dealing with a challenging client? Because often that happens. People go to rehab or treatment, I should say, when they get to the end of what they feel is their rope. They're not feeling very well mentally, spiritually, physically, and they might not really be themselves or act like themselves. So how we deal with it is very important. We don't want to hear that a person gets asked to leave or gets shamed or treated harshly. Very important when you're asking questions about rehab and treatment. So if you look at this slide, you look at the components of comprehensive substance use treatment. And it's really what you're looking at as a continuum of services. Everything that you would need once you exit a treatment program. First, you have to have a treatment plan. And it's a great thing as a family to be able to sit down with the care providers and say, what is that going to look like? And some of them might include child care services, vocational services, mental health services, medical and educational services, HIV/AIDS services, legal and financial services, and of course housing and transportation, huge, because where is a person going to go after they leave rehab? And then in the inner circle, you'll see that All of those things point to continuing care for your loved one, for someone who comes out of a rehab.
Mutual support groups are available out there. Mutual support, also called self-help groups, are an important part of recovery from substance use disorders. Mutual support groups exist both for persons with an substance use disorder and for their families or significant others, and are one of the choices an individual has during the recovery process. So the piece that we need to really pull from this are that, again, this is very individualized for not only the person, battling this disease or diseases, but also for the family. And there's not one way for everyone. So some of the possibilities out there are Project COPE. COPE stands for Connect for Overdose Prevention and Education. MARA, Medication Assisted Recovery Anonymous. Group therapy, SMART recovery, individual therapy, faith-based support groups. GRASP stands for Grief Recovery After Substance Passing. This is a support for families, loved ones, after someone has dealt with a loss. AA or NA, Alcoholics Anonymous or Narcotics Anonymous. Alateen or Al-Anon, these are the family support groups. ACA or Adult Children of Alcoholics. And Family Training or CRAFT, Community Reinforcement and Family Training.
So to add on to that, there are other grief groups. Like Robin mentioned, there's GRASP, which is Grief Recovery After a Substance Passing. There's Compassionate Friends, and you see that there's the website on there for anybody who thinks that might apply to them. Grief Share, there's GRASP, and Team Sharing.
So one of the things that I've learned is that there are many pathways to recovery, and one size does not fit all. Some of the pathways to recovery include inpatient and residential treatment, outpatient behavioral treatment, of course 12-step programs like AA and NA, medically assisted therapy, which is called MAT, SMART recovery, which is self-management and recovery training, Celebrate recovery, faith-based recovery, refuge recovery, all kinds of recovery.
So I'll start off with harm reduction, which is a big thing in the communities now. Harm reduction, I'll read it off for you. What is it? Harm reduction strategies seek to reduce the morbidity and mortality associated with substance misuse for those for whom abstinence is not an immediate and/or feasible goal. The goal of harm reduction models is to reduce at-risk, moderate and high-risk behaviors often associated with substance use disorders. And why do we need it? We want to respond to disproportionate diseases and fatality rates, reach the vulnerable populations, and keep individuals engaged if they relapse or are not abstinent from drugs or sex. Two common things that you might have heard in your communities for harm reduction are the syringe exchange programs you might have heard about, and Narcan, which is a life-saving device.
Robin and I are going to talk about a practical guide to coping with grief, and we also decided that when we were looking at this slide that Staci also can add to grief, because grief is not only for families of loss, it's for families that are dealing with loved ones that have to come to terms with the fact that their loved one has a substance use disorder. So grief comes in all forms, and you know, this slide really does talk about getting enough rest and maintaining diet and taking one things at a time, following a familiar routine, talking to supportive people. But you know, it's very individual. And I'll just say for me, it was putting purpose to my pain. I went back to work the week after my son passed because I needed to have something to do, and I could hear my son Rory say, "Go, Mom, go. Go to my mother, she'll help you." And I always did help my community, and that was very important for my survival. I cried through it every day, and I still do, but I knew that for me, that was something that I had to do to go on. And I also needed for my family to be supportive of me. And I also needed to be supportive of my family. And I needed to realize that it wasn't all about me, but I have children. I have 2 daughters that were dealing with the loss of their brother. I have parents that were dealing with the loss of their grandson, and so on. So it's highly personal. Wouldn't you agree, Robin?
Absolutely. Yes. Yeah. You know, so as we go on, they're saying, don't stay away. Don't stay away from work. Don't stay away from things that bring you enjoyment, other activities, extracurricular activities that you do. Don't withdraw. Don't withdraw from others. It's very easy, as a mother of loss, as Cindy stated, one of the first things that you want to do is withdraw from people because you want to protect the pain that you're holding inside. But on the opposite side of that, and then again, also as somebody that's dealing with this, with somebody that's in active addiction, or even if they're doing well, we often are waiting for that next shoe to drop, and there's that grief of many things that our children or loved ones have lost because of their disease. And you know, trying to not only help us go through that grieving process of things that might not ever be, it's helping them also learn how to move their lives forward in that process. Don't look away. Don't look for easy answers. There's no such thing as an easy fix, unfortunately, for this. If there were, we'd have less deaths and loss. Don't increase caffeine intake, you know, all of those things. Don't reduce leisure activities. It's important to take care of ourselves, find that, you know, so as Cindy said, I too kind of jumped out in the community, but I know that I'm the first one to say that I'm very good at helping, again, being a nurse by profession. I'm the first one to jump in to help everybody else and not focus on myself. And some of that might be a preservation because but that's where you have to learn to find that balance in your own healing and, you know, not overdo in one extreme to another.
Staci?
Mm-hmm.
So for me, as we were speaking of it, I am fortunate enough to not have lost my son to an overdose. He is doing well as we speak, but 15 years of dealing with a substance use disorder in your household, and the shame and the blame, and I'm not a good enough mom, and what did I do wrong, and finding people who are like-minded and that really understand. That doesn't mean that other people don't love you and care about you and that you can't, you know, get joy from them, but finding people who have gone through the exact same thing that you have gone through, that you are able to go with, and they don't think it's, okay, come on, get on with it, you know. I remember, unfortunately, I don't know if Cindy's going to be upset with me for saying this, but someone had said to her, well, you're never going to get over your son's death. And I was so angry, and because how could you? These things change us. These things change us. Sometimes for the good, most times for the bad, but we have to realize that we are dealing with constant, and it's not grief of loss, but it's grief of what we were supposed to think our children were supposed to be, or our loved one. It's not only about children, it's about families. There used to be a little story about someone getting on the plane and they thought they were going to Italy, and they arrive in Denmark, and they get off the plane and they go, oh dear, I was supposed to be in Italy. And they said, oh, but you know, Denmark has tulips, and Denmark has this, and so to be able to switch and figure out a way to love your loved one and be able to take some of the anger and a lot of the bad advice that was given to us and put it where it needs to go. And like Robin said, it's very easy to tell someone to get enough rest. It's very easy to tell someone don't reduce your leisure activities. We know that it's going to be part of it. But the more we speak and share without shame and surround ourselves with like-minded people, there is some kind of a peace and some kind of a joy that we get from the love that we receive from others. Thank you for letting me share that.
I just want to say one last thing. You know, the three of us are in this community center tonight because we truly believe that recovery is possible. Mm-hmm. And we also know that to help one is to help many. So that's what we're here for, and that's what we try to do. And thank you so much for being with us. We appreciate the opportunity to speak to you tonight. And I think we're going to take questions now.
I just want to thank all of our panelists for sharing. Thank you so much, ladies, for just sharing your stories with us and for all that information. And also, I realized in the beginning, I apologize. We are coming to you live and direct from the Palm Beach County Hub tonight, which is our Recovery Community Center. And these ladies all sit on the board. They are all a big part of just making this project come to life and providing a safe space for our recovery community members. So thank you for that and for your work in this community. Thank you.
Thank you.
So I'm going to take some time now. We have a few questions, and please keep them coming in the chat. We will be sure to ask as many as we can in the time allotted. So I'm going to go ahead with our first question. Ladies, and anyone can answer this. For someone who may have a loved one at home, a child who is battling with substance use disorder, the question is, how do I begin the conversation with my child?
That's an excellent question. I'll jump right in. It is a hard conversation to have. But when we're at that crossroad, when we know that there is in fact a problem, we do need to handle it with love first, but honesty. I was told in the beginning to practice tough love. I was told to do a lot of things that if I had a chance to do again, I would not do. But you only know what you know. So I would say that you need to, as a parent, sit down and have an honest but loving conversation. And also we get caught up as parents and as loved ones to almost sometimes take over the conversation and stop listening. We really need to learn to listen to our loved ones. The more I started to learn to listen to my son and others that I help, the more I was able to be helpful to them. Because I thought a way was right didn't mean it was. So again, to simplify, it needs to happen honest, open, and with lots of love.
I want to add to that. Just one little thing is that, you know, it's such an emotional roller coaster you're on. It's very hard to keep yourself in check when you're talking to your child, and you know, when you're watching your child destroy their lives, and you know that They don't want to. Nobody wakes up in the morning and says, guess what? I think I'm going to be a person with substance use disorder. For me, it was just a roller coaster of emotions, and I used outside help. I went to Naranon for 4 years. I spoke to a therapist because it was just so difficult to do.
And I just want to add one other thing to that as well, is that when we're having that conversation or you're having that conversation, it's probably not going to go well the first time you're having that conversation. So don't be surprised that you're greeted with storming out the doors, screaming and yelling, slamming doors, I'm never going to do this, you don't know what you're talking about. Those are normal things. Might not happen the second, might not happen the third time. But again, as you're loving and supporting, that is the best, and try to continue to be consistent. As Cindy said, there's a lot of emotion on both sides, a lot of fear, anxiety, you name it, the gamut of emotions are in there. So that's just important to remember, and reaching out to other people, for that support during that process as well.
Thank you for sharing. So as a follow-up to that question, how do I protect my other children in the home? I know one of you mentioned that you also have 2 daughters. How do you sort of have those conversations with them while also, trying to support them?
I think I was the one that mentioned that I have 2 daughters. It's very interesting to this day. My daughter will say to me, Rory's not here, but we are. So I have to make sure that I find balance in my life. I have to acknowledge that they lost their brother. When my mother talks about losing my father, I say, but it's not the same as losing a child, and that's not the right answer either. So I have to, it's constantly keeping yourself in check, and recognizing and understanding that everyone has different feelings about this, but that you have to acknowledge their feelings. You can't negate them or say that they don't matter as much as yours. So, and also, for me, it's also talking to my dear friends on either side of me and in this room, and getting that support and sharing some of those conversations so that they can help steer me back.
Thank you for that. We also have some questions from members of our audience. So if any of them would like to come up to the podium, I will step to the side. Thank you. Let's come right around back.
How do I set boundaries with my loved ones?
That's a great question, Sharon. I think we fall into a very black and white kind of a thing. We're going to do this or we're going to do that. And that is kind of what a boundary is. You do this or you do that. But there is this gray area, and you can increase. As unfortunately, sometimes this lasts a long time, you have to really be honest with yourself about what it is that you're willing to deal with, what it is, how you're willing to deal with it in your own home. And that is very different for everybody. Because as we, I don't want to speak for the other ladies, but we've spoken to so many people, and their boundaries are different for everybody. For me, my boundary might have been, you could be in my house and I'll treat you like an adult, and you go to work and I'm not going to have a curfew, but there's no drug use in the house. And if there is drug use in the house, I'm going to have to ask you to leave. So it's a very, it's a great question, but it's a very individual question. And I think it's a very necessary also conversation to have. There needs to be boundaries, and it needs to be very, very clear to the person that you're dealing with what it is that you are willing to do and what it is that you are not. Say what you mean and mean what you say. And do it, again, I go back to it, with love.
Yeah, and I'll add in again, so there's a lot of fear that we might feel when you're dealing with this situation. The fear of if for some reason, I do have to ask my child or my loved one to leave the home, if they, they die out there, then was that the right decision for me? A lot of guilt, a lot of, judgment of our own selves. There's a lot of, would have, should have, could have, can we, can't we, all of those things. So again, as Staci's saying, it's an evolving thing. This has been part of my life for over 18 years. My older son is also in recovery, and for today he's doing well. But I take, again, that one day at a time. And as each scenario presents itself, we deal with that is in an open and honest manner as we possibly can. And as I'm working with other families or people out there, encouraging them to do that same thing. Beating ourselves up is the worst, one of the most negative things that any of us can do. There's no perfect answer. There's no perfect fit for this. Some of it is going by gut. Some of it is listening to other people. If you've been doing this for a lot of years, as Staci alluded to earlier, we've been told, like, you have to draw this strong line and, shut the door, to your loved one. Just be prepared for a lot of things to happen, but reach out and don't try to do this by yourself. I think that's one of the most important things. There are other people out there, and when people hear and you're answering them on the other end of the line or meeting in person or whatever, that's one thing that's consistent I hear with people over and over again. Just thank you for letting me know I'm not in this all by myself.
I want to add just one comment to that. I'm listening to Robin and Staci, and I'm thinking that I speak to a lot of parents of loss, and they always say to me, "Don't you feel guilty?" And I really don't. Honestly, I've thought about this over and over again, and I've talked about it a lot too. I ask myself the question, did I do the best that I could do? And the answer is yes. Would I change the outcome? Of course I would. But I did the best I could. And so if we do the best we can as parents, that's all we can really expect of ourselves.
Thank you for that, ladies. We do have quite a few questions that are coming in from the online chat. So I will go in the order that I have received them. The first question, and this is sort of technical, but how are rehab patients able to stay beyond the 28 days? Have you identified any ways, any methods, any tips?
I
ahead,
guess I'll. Unfortunately, a lot of it, if you have insurance, it is mandated by insurance. One of the things that I would encourage anybody is to begin that relationship immediately upon your loved one going into treatment with case manager, the team, so that they are working on the correct documentation as to how your loved one is, following up. The standard of care for many insurance, 28 days. Can that be moved past? Yes, it can be moved past. And I think part of that is you having that relationship, you're encouraging your loved one to speak out, things might not be addressed, and just keeping that door open. Unfortunately we are, but insurance is, things can change with insurance. So don't, shut that door and accept, okay, somebody's coming out at 28 days. It does not have to be. So.
Thank you. That was actually, I think, good information. Our next question. What are some skills and activities family members need to practice and implement in order to better support their family members who are in active addiction?
I would definitely say that we have to practice self-care first. The focus has to be on yourself. If the focus isn't on yourself, you really lose your way in all of this. So it's a constant push-pull. It's a constant help your family member take care of yourself. Reach out to your friends. Look for resources in the community. And we're so lucky to have this community center today. Boy, what a difference that would have made for me and the rest of my family. If we had a place to go and a place to talk to someone who could possibly guide me in this direction, in this arena that I knew nothing about. So for me, yeah, it's just constantly reaching out, but also taking care of myself in the process.
Piggybacking off of that, I think the question also was about what kind of activities can you have with your loved one while they are in active addiction? Was that the part of the question? Okay. So for me, because my son has struggled for so long and there's been, goods and bads and once I stopped taking off of this idea that I can't love him anymore, or I'm not supposed to love him until he does this, or I'm not supposed to take him to dinner if he does that, or I'm not supposed to buy him a birthday gift because look what he did. Once I was able to relieve myself of that mindset, I was able to enjoy him for who he is and really just let him be and try and encourage him to get the help that he needs. And I do believe that it has worked so much better. I did seek my own therapy and speaking to someone, and while he was doing his thing, he was able to come back and, like this last time, was able to say to me, I'm so glad that I was able to spend that time with you, because what do we have if we don't have love, and we don't have, why can't we go to dinner together? Why can't we that? Everything's not off the table just because they're using. We hope, obviously, that we can get them to get well because we want them to get well for themselves. But I don't think that everything is off the table. I think that you should try your best and still extend the invitations, the family invitations. Obviously, again, going back to the boundaries, you don't want someone to show up at a holiday dinner when they're not in the best of ways. But other than that, if they're able to, we should allow them to, and stop being so punitive.
I think that's really great advice.
Yeah.
For all of you ladies. So we do have another question that sort of ties in line with the last one. What about sober friends helping other friends who are in active addiction? What advice do you have for those friends?
I think that, again, I mean, part of what this program, what this Recovery Community Center is about peer support. So one of the best people or persons that are going to help somebody that's in active addiction is going to be a peer that's gone through exactly and walked that exact road. Better than anybody, they're going to be able to call them exactly where they are. Again, it might not be received well, but they can do that. They can help to, lead them towards resources. And in that as well, I mean, it can also be hard for those friends that, you might be living together in a sober house or something like that, and you're watching your friend start to struggle, and you don't want to out them. You don't want to tattle and let them know. So, I mean, that again it's a hard place for maybe somebody that's newer in recovery or even longer term to walk through that. But again, I think that peers are a very positive, and they're going to be able to bring them to meetings. They can encourage them to hear or that this doesn't, you had a blip, It's not the end of the road. You can get up and you can begin again. So I think that that's extremely vital for them.
Yeah, and in that vein, I like to say that, you know, especially when you're brand new in recovery, reaching out to people who are doing the work and can actually kind of could support you, a little hand holding. Yeah, and again, like Robin said, tell you the truth, be honest with you, and love you when you can't love yourself. But it's very, very important because they have spent so much time in isolation. So it's very important for them to reach out and make sober friends, and for the sober friends to support them. And with that, the sober friends can give back as well, which is part of this whole cycle is people helping people. And it can be a really beautiful thing. When I've gone to meetings, I've seen, you know, when people will celebrate, you know, an anniversary, and, you know, there's a bunch of guys in the back, you know, hugging each other and saying, you know, I love you, guy. I love, you know, it's just, it's so heartwarming, and it's life-changing for someone who is isolated for so long that they can go into a room and they're not judged, and they can walk out and actually have someone say, I love you, and no strings attached, no anything, but just feel okay being who they are.
And I think we've, one of our friends said recently, recovery can be fun. Recovery should be fun. So again, I come back to this center. You know, we're going to have, a lot of people suggested that we have, you know, sober events here, which is why this is here. So that you can see that, yeah, you might be struggling, but you have a place to go with others who are in the same position, perhaps, or suffering from the same disease, but you can still live and enjoy and have fun and be part of a community. When you're connected to a community, you know, your odds for feeling better and getting better increase tremendously. So I can't help but say, as I sit in this wonderful space, that I really feel that a recovery community center such as the Hub is going to make a difference for a lot of people. Thank you so much, everyone, for joining us tonight.
At the end of the
We would like to thank our audience, thank all of you out there who have tuned in via Zoom, watching our live stream. We want to remind you that this isn't over. This is only part 2 of our 7-week series. So we invite you to go on our website, hanleyfoundation.org, and register for the upcoming events every Wednesday, 7 p.m. at the Hub in Delray Beach, Florida. Thank you so much and have a wonderful evening.